This morning we're here to celebrate the 50th anniversary of our College of Health-Related Professions, our College of Nursing, our School of Graduate Studies, and University Hospital of Brooklyn. 50 years, that's a long time. Can we give a nice round of applause? We've done some great work, and we've gotten some acknowledgements from our elected officials as well as some of our local business enterprises. But to move the program along, I'm going to open the podium and have our distinguished President, John Williams, please come to the podium.
Nice to see everyone here. I am going to be mercifully brief. It is actually my great privilege to officially begin the commemorations for the golden anniversary of University Hospital of Brooklyn, the School of Graduate Studies, the College of Nursing, and the College of Health-Related Professions. 50 years of educational leadership in the health sciences integrated into our hospital clinical programs is what we celebrate. Thousands of students have been trained and educated at Downstate and at University Hospital, the vast majority of whom practice and serve communities in Brooklyn, New York City, and New York State. And the governor actually acknowledges that, which you'll hear about a little bit later. Many are leaders in their field and recognized nationally. We can be proud of our role in educating a very diverse population of students and residents. It is our commitment to train a workforce reflective of Brooklyn, and we continue on that journey. We care for communities of great diversity, providing accessible specialty care unavailable anywhere else. Our vision of health equity for all drives our programs. Today's healthcare environment is challenging, and we are preparing the next generation of healthcare provider in their practices and for lifelong learning. Our hospital is leading the way for Central Brooklyn residents and is needed more than ever today. Today we are unveiling pennants throughout the neighborhood. I'm not going to do that, it's too cold. And commemorative banners to celebrate Downstate's role in education, patient care, and research within our community. Over the next year, we will have a series of events to honor our golden anniversary. At this time, I'd like to turn it back over to Michael.
At this time, I'd like to share with you some acknowledgements from our elected officials. Not everyone has been able to send in their proclamations, but we expect several more proclamations to come in over the next few weeks. Right now, I'd like to share an acknowledgement from our governor, Andrew Cuomo. It's a pleasure to send greetings and heartfelt congratulations on the occasion of the celebration of the 50th anniversary of SUNY Downstate Medical Center, College of Health-Related Professions, College of Nursing, School of Graduate Studies, and University Hospital of Brooklyn. The Empire State recognizes the importance of an excellent education in health-related professions and gratefully acknowledges those outstanding institutions that foster intellectual and personal growth of their students while instilling in them a lifelong appreciation of learning, health, and wellness. Since 1966, SUNY Downstate has had an exceptional reputation as one of the nation's leading urban medical centers with a world-class faculty and in a state-of-art setting where research and education are put into practice. Reflecting the noble traditions of the State University of New York, this medical center can be proud of its research discovery, academic excellence, and outstanding patient care in the heart of the greater metropolitan area. For 5 decades, SUNY Downstate's excellent programs have graduated thousands of diverse individuals who have a clear sense of their professional role, prepared to make a positive difference in an environment of complex and ever-changing health needs. This is a significant milestone, and on behalf of all New Yorkers, I commend those affiliated with SUNY Downstate Medical Center for their unwavering commitment to the healing ministries and the delivery of health care that emphasizes dignity and respect. With warmest regards and best wishes for many more years of great success ahead, Governor Andrew Cuomo. Give yourselves a hand. Now, I've received proclamations from our Senator Marty Golden. I'm not going to read them all. I will read one other one, and this is from our mayor, Bill de Blasio. And I'm not going to read, can you see this? I'm not going to read much of it, maybe just the last paragraph. As one of our nation's leading urban medical centers, SUNY Downstate has added to the rich fabric of the borough with its longstanding commitment to education, innovative research, and bettering the health of the surrounding community, from its College of Health-Related Professions, College of Nursing, and School of Graduate Studies that have trained generations of dedicated healthcare professionals, to the University Hospital of Brooklyn that provides accessible healthcare to thousands of residents annually. SUNY Downstate has encompassed the care and compassion that our city is known for, while also helping to advance the field of medicine. Now, therefore I, Bill de Blasio, Mayor of New York City, do hereby proclaim Tuesday, January 19th, 2016, in the city of New York as SUNY Downstate Medical Center Day. Give yourselves a large hand. Okay, now I just want to bring up a few of the deans to give remarks. And first one on the roster here is Dean Lewis. Dean Lewis, please, of the College of Health-Related Professions.
It's great to be here. I'm in my second week on the job, and it's great to come to a place with a 50-year history of excellence. I'm so glad to be here. Welcome to our 50th anniversary celebration kickoff event. Just to give you a context, here's what was happening 50 years ago in addition to our program starting. Lyndon Baines Johnson was president. George Wallace was governor of Alabama. The United States and the Soviet Union were engaged in the Cold War and the race to be the first to put a person on the moon. There were race riots in several U.S. cities. The United States had approximately 500,000 troops in Vietnam. The cost of a postage stamp was 5 cents. And there was a subway strike in New York City. In that same year, the College of Health-Related Professions was formed with 3 departments: occupational therapy, physical therapy, and medical computer science. Now, a word about each of the 6 departments in our prestigious school. The occupational therapy department started in 1966 and has educated to date over 1,200 occupational therapists. The physical therapy department started in 1966 and has educated over 1,000 physical therapists. The diagnostic medical imaging department began in 1972 and since that time has educated over 800 sonographers and was the first Bachelor of Science program in the nation to offer a degree in sonography. Our medical informatics department started as the Department of Health Information in 1971 and took on the name Medical Informatics in 2003, and to date it has graduated over 450 students. Our midwifery department started in 1974 as the first midwifery program in the nation to train non-nurse professionals. So you didn't have to be a nurse to be in the program. To date, it has graduated approximately 500 students. Our Physician's Assistant Department started in 1990 and is one of the few programs in the nation that targets its training to train primarily urban PAs. To date, it has graduated 600 plus graduates. So as you can see, the footprint of this particular college is quite large. We've graduated just under 5,000 students in the last half of a century. Again, I welcome you to the 50th anniversary celebration kickoff event as we commemorate the half century of excellence that our college has had, and we look forward to training more quality health professionals going forward. Thank you very much.
May I formally introduce the Dean of the College of Nursing, Daisy Cruz.
Daisy Cruz Richmond. Good afternoon. This occasion has a special significance, for this year marks the 50th anniversary since the College of Nursing was established. This is truly a milestone and a year of celebration. 50 years is really quite remarkable. The first program established by the college in 1966 was a generic baccalaureate program housed in the T building at Kings County Hospital. The faculty's philosophy then was grounded in the belief that entry into professional nursing must be at the baccalaureate level, and this philosophy continues to this day. In the last 4 years, research studies revealed that employers nationwide prefer beginning nurses educated at the baccalaureate level. The movement to increase the number of baccalaureate-educated nurses is accelerating following the release of landmark reports in 2010. For example, the Institute of Medicine's report and the Carnegie Foundation's report, which clearly link nursing educational level to enhance patient outcomes, and evidence is growing revealing the same findings. The College of Nursing's philosophy in 1966 about baccalaureate nursing degree is now a required degree in many healthcare settings across the country. In 1970s and 1980s, nursing education experienced tremendous change and growth. The RN to BS program, because the College of Nursing faculty believe in educational and career mobility, was established. Nursing education continued to advance further in the 1980s and 1990s. We established the clinical nurse specialist for adults in 1986, followed by a clinical nurse specialist program in mothers and infants in 1988. The College of Nursing would enter 1990s amidst new technology, innovative educational approaches, and changing the face of nursing education. By 1993, the College of Nursing found its home in the then new building, the Health Science Education Building, up on the 8th floor. Finally, in 1993, we had a real home. Faculty, staff, and students moved into the new home on the 8th floor with joy and exuberance. In the 1990s, a shift in healthcare landscape began to take hold. Healthcare was increasing by shifting away from acute hospital-based to outpatient ambulatory care settings. Then the faculty further advanced its programs by developing advanced practice roles. The Women's Health Nurse Practitioner was established in 1993, followed by the Family Nurse Practitioner track in 1995, and postgraduate certificate programs in nurse practitioner in 1996. Over the years, the College of Nursing continuously examines its programs to stay relevant, to revise its curricula to respond to trends in healthcare, higher education, and nursing. In 2003, in response to the nursing shortage at the local, state, and national levels, the college launched a 15-month accelerated program for second-degree students with no SUNY funding. From 2003 to 2009, the program was fully funded by the federal government, and in its second year of funding, HRSA named our accelerated program one of the 7 best nursing education models nationwide. This program continues to be one of the most competitive and successful programs in the College of Nursing. Curriculum is dynamic, so in 2013 and 14, the undergraduate and graduate curricula was revised to reflect the core competencies postulated by the American Association of Colleges of Nursing. We have so many accomplishments. I will just identify 3 major accomplishments. To me, these 3 define the College of Nursing characteristics. 1, we are enormously proud of our rich tradition of successfully recruiting, enrolling, retaining, and graduating a diversified student body, including those from minorities and males. 2nd, our track record of receiving the maximum years of national accreditation, 8 years of accreditation from the National League of Nursing until 2005. Then in 2004, we moved our accreditation to the Commission on Collegiate Nursing Education, CCNE, receiving the maximum 10 years of accreditation in 2005, and more recently in 2015, with no single citation or areas for improvement. 3rd, our proven track record of outstanding outcomes, 98 to 99% graduation rates, 92 to 100% employment rates within 6 months after graduation, and national certification pass rates and licensure pass rates consistently exceeding the New York State and national means. Last Friday, I received an excellent news. Our 2015 Family Nurse Practitioner Certification pass rates achieved 100%. Our stellar record of accomplishments is really a tribute to our past and present cadre of outstanding faculty, staff, and students, all of whom is a great inspiration to the next generation of nursing professionals. As we enter the beginning of the next 50 years and beyond, I am confident that the college will continue to attract excellent faculty, staff, and students. In the next 50 years and beyond, the college will continue in its commitment to diversity, opportunity, innovation, and excellence. For many years, I taught in undergraduate and graduate programs. I am in my 14th year of serving as dean, and I'm truly honored to be a part of the College of Nursing's legacy of excellence and success. Thank you.
I'd like to introduce Dr. Mark Stewart, Dean of the School of Graduate Studies.
Thank you, Michael. The School of Graduate Studies was established in 1966 under the leadership of Dr. Chandler McCuskey Brooks, our first and founding dean. Dr. Brooks was an extraordinary physiologist who had worked with Walter Cannon, Philip Bard, and Jack Eccles. His interests ranged from the sinoatrial node cell pacemaking mechanisms to inhibition in the spinal cord, but he broke entirely new ground with his work on neuroendocrine physiology. Dr. Brooks had already built an exceptional department then of physiology and pharmacology, but split the department as a way of recruiting Bob Furstgott, who went on to win the Nobel Prize from this campus, and he had hired Furstgott to run pharmacology. Brooks served this institution and the State University in so many ways that my sources tell me the distinguished professor designation was actually created to honor him. Chandler Brooks served from 66 to 72. Our second dean, Paul Dreisen, served for a remarkable 25 years, from 72 to 97. Susan Schwartz-Giblin from 97 to 2008, and I'm the fourth dean from 2008 till today. We've granted 554 doctoral degrees to this point, and as such, we're the smallest school on the campus. But our students have had a major impact on the research done here. All of the most successful labs have depended heavily on the hard work of our graduate students who function as apprentices in the lab as they prepare their thesis projects. As one example, Dr. Raymond Damadian, who built the first MRI scanner, which is on display at the Smithsonian Institute, had two postdoctoral fellows, Larry Minkoff and Michael Goldsmith, who were earlier his students, and at least 10 other students who collectively worked to get the first images from living humans. In typical, and I put that in quotes, fashion, the device would only accommodate someone the size of a graduate student. But I'm thinking if I make a huge magnet that's never been tested before, I need a guinea pig. The first 5-hour scan of Larry Minkoff's chest was completed on July 3rd, 1977. So Larry's famous for being the first imaged human. Graduate students continue to carry a huge load in the lab, but we've been getting them into the community more and more. Programs that use graduate students to teach science and math in hands-on fashion to middle and high school students have been such a huge hit in our borough that our students have gone on to develop entire curricula that are being used by the New York Academy of Sciences and even been recruited by area schools to run their STEM programming. As much as the funding for research has been a hellish challenge for some time now, graduate students are the lifeblood of research anywhere. We look forward to the next 50 years as an opportunity to discover our students' capabilities as they make biomedical discoveries here at Downstate. Thank you and enjoy the annual celebration.
I'd like to take this time to welcome Mr. Bill Walsh, our Senior Vice President for University Hospital of Brooklyn. Bill Walsh.
Thank you, Mike. It's a pleasure to be here. Since University Hospital of Brooklyn admitted its first 2 patients in November 1966, we have served the borough as the major academic medical center for half a century. Thousands of patients, students, employees, and faculty have been part of our community. We bring together our academic and research mission into patient care unlike any other hospital in Brooklyn. University Hospital provides patients and neighborhoods with health care for everyday needs and the most specialized services for complex diseases, illnesses, and injuries. We offer unique care not available elsewhere in Brooklyn, as well as training generations of healthcare professionals for Brooklyn, New York State, and the country. Our physicians treat nearly 16,000 inpatients a year and over 300,000 ambulatory patients. Healthcare is rapidly changing in where and how we treat our patients. As we move into the next half century, we will build a proud legacy of innovation, caring, and training. Among our many achievements over the years, Downstate physicians have been pioneers in kidney dialysis and transplant. The first African-American transplant surgeon founded our kidney transplantation program in 1972, and we were the first in New York to successfully transplant an African-American patient, the first to perform a successful kidney pancreas transplant, and the first to perform dual kidney transplants. We are the sole pediatric dialysis center in Brooklyn. Healthcare is changing, and we are at the forefront of this change. But our mission and values do not change as we move towards the vision of improving the lives of our globally diverse communities. Thank you.
At this time, I'd like to bring to the podium a real friend of Downstate, one of our elected officials that's always been there for us, has always wanted to know what do we need and how can he help. And he's always dedicated to raising the standard of health in East Flatbush and his entire district. I would like to bring to the podium our council member, Matthew Eugene.
Thank you very much, Michael. To the President, President Williams, faculties and staff, to the students, and all the wonderful members of the Downstate Medical Center family. I'm very delighted to be here with you today. Even I won't be able to stay because I got to rush back to the city council because we have the stated meeting and I got to take care of the business of the city, your business. I got to go back to vote. But I couldn't miss this opportunity to be here with you on this momentous occasion as you celebrate 50 years of achievement, accomplishment, the robust history of Downstate Medical Center that has been making any effort, everything to make our city great, one of the most important cities in healthcare, also research and medical services. I'm going to present a proclamation from the great city of New York. On this occasion, the proclamation reads, the Council of this New York City Proclamation. Whereas Matthew Eugene, council member of the 48th District, is proud to celebrate the SUNY Downstate Medical Center College of Health-Related Professions, College of Nursing, School of Graduate Studies, and University Hospital of Brooklyn for 50 years of extraordinary service and achievement. And whereas this is the only academic medical center in Brooklyn and serves more than 2.3 million people, it is an anchor in educational excellence and an engine of opportunity for students interested in pursuing careers in healthcare. Many students are the first in their families to attend college and to pursue careers in our communities. Whereas the College of Health-Related Professions and the College of Nursing were both founded in 1966, the College of Health-Related Professions is dedicated to educating the next generation of health professionals in diagnostic, medical imaging, medical informatics, midwifery, occupational therapy, physical therapy, and physician assistant. The College of Nursing is one of the largest in New York State, offering both BS and MS degrees. It is one of only 4 colleges in nursing in the state of New York to offer a master's degree in all advanced practice roles, including clinical nurse specialists, nurse practitioners, nurse anesthetics, and nurse midwives. The College of Health-Related Professions and College of Nursing also have the oldest midwifery program in the country. And whereas the School of Graduate Studies, founded in 1966, is dedicated to training future scientists and providing students with the tools they will need to contribute to the body of scientific knowledge. The school grants the PhD degree, and with the College of Medicine sponsors a combined MD, PhD degree. Graduates are represented nationally and internationally in the scientific research, postdoctoral studies, academia, and industry. And whereas University Hospital of Brooklyn, UHB, built in 1966, is the primary clinical training site for medical, allied health, and nursing students, resident and fellows. University Hospital of Brooklyn offers the only kidney transplant service in the board, and its pediatric dialysis program as signature programs. The New York State Department of Health has certified UHB as an AIDS center, stroke center, and regional prenatal center. And whereas more physicians who practice medicine in New York City receive their training at the College of Medicine than any other medical school in the country, the College of Medicine has trained nearly half of all doctors in Brooklyn in the numerous specialties area. Now, therefore, be it known that Matthew Eugene, council member of the 48th District, proudly honors SUNY Downstate Medical Center's College of Health-Related Professions, College of Nursing, School of Graduate Studies, and University Hospital of Brooklyn in the celebration of its 50th anniversary, signed this 19th day of January in the year 2016, Matthew Eugene, New York City Council, 48th District, Brooklyn. Thank you very much.
We want to thank Matthew Eugene for coming and making the presentation, so give him a round of applause. And we'll ask that Bill Walsh, all the deans, come and take a photo with the councilman as a group shot. Carlos Cicera, who is the president and CEO of the Brooklyn Chamber of Commerce. We have his senior administrator here, Veronica Harris, Brooklyn Chamber of Commerce. Round of applause, please. We want to thank all the students for being here. Give yourselves a round of applause. You make everything happen. And we look to you to make healthcare much better for everyone in the future.